When you're entering your unit and preparing for unit care, you'll want to wash your hands 2 times, 15 seconds each. Dry thoroughly, and you'll follow the demonstration shown in instrument processing. Apply your PPE, and at this point the gloves you'll wear are your utility gloves. Now when you're looking at your unit, you want to make sure that you have all of the paper towels that you'll need during your procedure. Your swipes container is full. You have tissues, you have overgloves, you have all of the barriers that you'll need for the procedure as well. So at this point, just make sure you check everything is replenished and full. And the first thing you're going to do with the cart is pull your cart out, and you're going to fill your water bottle. So this is done before you pressurize the unit and before you're going to use it for the day. If there's water already in it, that's fine. It doesn't need to be refilled. But in this case, the water is empty and I need to refill the water bottle. So all I'm going to do is turn the water bottle and pull it off of the port. Now you want to make sure that this plastic tube does not get contaminated. And if it does get contaminated and touch some other surface, then you have to wipe it down with your swipes with a disinfecting cloth. Now you're going to take your water bottle and fill it with distilled water and put 1 squirt of the E2O water bottle treatment solution. So once you've filled your water bottle and placed the E2O, then you're going to reinsert it onto your cart, twist it, and make sure it's secure. Now at this point, you're going to look under the unit and pressurize the unit. So you're switching the toggle. You can hear that pressurization. And then you're going to switch the other toggle so that you have power for your handpieces. Now your unit is restocked and ready for you to wipe everything down and prepare it for your procedure. So the first thing you'll do is take your swipes container and use a stack of wipes so that you've got good coverage. And you'll start with your dental unit. The switch on the light, and the handles on the light, the headrest, the switches on the side of the chair, the armrests, the operator's stool back, and the switches, the rib cage arm on the assistant stool, switches, and then proceed to the back of the unit. Sinks, taps. You'll check for dust or debris and give everything a wipe that's going to be used during your procedure. Now if your cloths get dry or soiled, then throw them out and get another stack of cloths. So now I'm ready to move on to my cart. And I'm only going to disinfect items that I'll use during my procedure. So I'm taking off my handpiece coupling and wiping the end of the coupling as well as the hose. and then I'll go back to the bracket. I'm going to use the 3-way syringe. The saliva ejector. And I'll use one suction only, just one of the HVEs. And make sure to wipe down the hose too. They do hang and dangle on the floor. Okay. At this time, the rheostat is stacked on the holder at the back of the cart. So at this time, I'll pull it off and just place it on the floor and have it positioned and ready for use. And then I'll just take a look at it and polish it up so that it's nice and shiny for when our patient arrives. So that's your first wipe. Then you're going to take your second stack of cloths. Now, because my gloves were stored in a plastic bag, I just put them on and started wiping my unit. But now that I've touched items that were dusty or possibly not disinfected, I'm going to disinfect my gloves first. So that now with the second wipe, everything is going to be disinfected. So I'll go back to my dental light and disinfect the handles, the headrest on the chair, the armrests, the switches at the back of the chair, and I'll continue on with the operator's stool and the assistant's chair. Then I'll come back and continue with the sink and the taps, and the counters. Everything that I wiped the first time to remove debris, I'll wipe the second time to disinfect. The handle on the patient light can also be wiped. And then you're going to go on to your control panel, again with the handpiece. Now if you're using more than one handpiece during your procedure, obviously you're going to wipe both of them. But for our purposes, we're simply training to prepare your units for a specific procedure. Okay. My rheostat doesn't need to be disinfected because it's polished, ready for use. So I'm just going to wipe down my gloves because now I'm finished with them. And I'll remove my utility gloves. And roll them up and store them in a baggie. So when I go to use them next time, they're disinfected and ready for use. So at this point now, my hands are a little bit sweaty. I don't have to use the soap. I can use a hand sanitizer to clean my hands. And the hand sanitizer is used the same way as your soap, and that as well is demonstrated in instrument processing. I'm going to open up the drawer, the door to the barriers, and I'm going to take out the roll of sticky barriers, and I'll take out 3 sleeve barriers, 1 headrest cover, and 1 bib. And I'll put on the headrest cover at this point. And I'll place the sticky barriers. Now for the procedures, you'll be placing barriers on every item that you feel you'll need barriers during your procedures. But for your evaluations, there are 5 mandatory barriers. So the handles of the light, the switch on the light, and the switches on the dental chair. Other than that, during your procedures, you'll be able to bury anything that you want to touch during your procedures.